Yeah, the GLIMMER-01 trial is a phase 1 clinical trial, which we're reporting here at AACR 23 in the dose escalation portion, investigating the novel agent E-602. And this is a bi-sialidase molecule. So what is that? Well, it's a molecule that cleaves off glycosylation patterns that are aberrantly expressed on tumor cells. And this is a new area of research in cancer research. And so Carolyn Bertozzi won the Nobel Prize for Chemistry a year ago to the discovery of these glycoimmune checkpoints and her contribution to the chemistry that outlined that. And this is the first clinical trial to attempt to use that technology to treat patients with cancer. And the concept is that aberrant glycosylation patterns on tumors can allow immune evasion because functionally the T cells can't see the cancer to kill them. And by cleaving off these abnormal glycosylation patterns, that allows T cells then to get in to kill the cancer.